Hello and welcome to Freedom from Fear, a German New Medicine podcast. I'm your host, Ashley Newberry.
And I'm your other host, Abigail Puccioni. Please be aware that nothing discussed here on this podcast should be taken as medical advice.
Consult your trusted professionals and your own inner knowing before making any health decisions.
Hey everyone, welcome back to today's episode. We have a really special guest here today that specializes in the topic of women's health and pelvic health specifically. And so we will be covering the cervical adaptation, which is something that's been a very highly requested topic. And I know we've touched on this a little bit before in previous episodes, but today we're really going to do a nice, juicy deep dive and really unpack what we call the sexual frustration conflict and the whole world of cervical adaptations.
So on our podcast today, we have Qiddist. Qiddist Ashé is a traditional midwife, women's health educator, and translator of the mystical science of our bodies. She runs the Womb Room, a global virtual learning community for women, and integrates her background in clinical herbalism, homeopathy, somatics, neuroscience, hands-on pelvic care, and more into her embodiment of the Germanic healing paradigm. Welcome, Qiddist.
Thank you both so much for having me. I am excited to dive into this very vast topic that is near and dear to my heart and my work and also my own lived experience. So thank you.
We're so excited to have you. And I know, Qiddist, we recently were able to hang out in person when we were in Vancouver at a GNM workshop. And we had so many great conversations around this topic. And so I'm really excited to bring some of these conversations to the pod and share them with you guys. So take it away. Let's just dive into the cervical mucosa adaptation and the associated conflict and unpacking all the nuances behind that. And take it away.
Great. So I like to break this down really in simple terms. So if you have ever gotten a pap smear, you have engaged with our cultural and societal understanding or misunderstanding of the cervix program. If you've ever had an abnormal, air quotes, pap smear, then you have run this program. It is incredibly common. And I would say it is one of the most prevalent, if not the most prevalent, biological program in women's health that impacts a lot of different areas of female health in general. So it's one that is good to know about. The language that GNM uses to describe this conflict is a sexual frustration conflict. I don't often use that language because it's so confusing. Because when people hear sexual frustration, they think about being sexually frustrated, like perhaps like wanting sex and not being able to have it, right? And that's not necessarily what we're talking about here. So I often just say a sexual conflict, or sometimes I'll even say a sexual belonging conflict, which I know that is not the Dr. Hammer language, but that's language that I have found useful in helping women understand what are we actually talking about here. So this is a program that has to do with belonging in intimacy. So we're not talking about belonging writ large. We're not talking about those other programs. We're talking about, I often say, who do I belong to in partnership? Who is the person that's going to protect me? Who's the person that is claiming me, right? It's this very primal relationship conflict. And we're talking about the cervical mucosa. So just basic anatomy, because no shade to anyone, we did not learn this stuff in school. So when we're talking about, right, like sex ed, it's pretty not great. So when we're talking about the cervical mucosa, we're talking about the face of the cervix, which is at the top of the vaginal canal and is the entry to the uterus. This is what dilates to release menstrual blood, to release cervical fluid, to release babies, and of course, to let in sperm. And the cervical mucosa is part of the ectoderm program and governed by the temporal lobe. And the reason that's important to know is that our temporal lobes are really responsible for our hormones. In particular, the left temporal lobe governs estrogen. So just keep that in mind, because so many of us have hormonal issues, and many times, not always, but many times they're related to this program. So when we experience a unexpected thing that catches us off guard, that leaves us feeling isolated, particularly around a distressing experience to our sex and sexuality, a distressing experience that leaves us uncertain about who our partner is, an experience that makes us feel like, whoa, who do I belong to here? Or, ooh, my sex, the territory of my body and my sexuality is being threatened in some way. Depending on, of course, our unique psyche's interpretation and experience, this can trigger this particular program. What happens in this program is, again, the body, I think you said this, Abigail, really well in a previous episode about how the body doesn't hear like, I want a baby, or I don't want a baby, or I want, or I don't want. It just hears the thing. So when we have a conflict around sex, around intimacy, around this intimate belonging, our animal body, of course, is going to be like, well, what's the best way to resolve that conflict? It's to make it more possible to reproduce.
Yeah.
That will help us be safe. That will help us continue our lineage. Problem solved, right? So what happens in this conflict is that there is an ulceration or cell loss around the face of the cervix. The reason for that is actually, it's quite literal. It's to widen the face of the cervix, widen the cervical os opening, so that when mating does happen, there's more chance of conception. It's like, whoa, we're uncertain here. We don't know who our person is, or we feel threatened in our sexuality. Let's make sure that when it is time to mate, let's make sure we do reproduce. Another way to say this is it's a mating conflict, which is different than some of the other reproductive programs.
I'm loving this explanation. I think this is a really clear, well-described way of unpacking this conflict or this adaptation.
Feel free to jump in anytime. So we're in the active conflict. The cells are widening around the face of the cervix. During this time, we might not experience any symptoms. And many of us who have had an abnormal PAP, which is quite common and normal, are like, oh, I didn't know there was anything going on, right? It's very common, particularly in a mild to moderate sexual conflict, to not have any symptoms. If we do have symptoms during this active phase, typically, again, we're going to have like the ruminating thoughts about the partner, about the belonging, or who am I going to be with? Who's going to be the father of my child? Who do I make family with, right? Who's my protector? And we might also have chest pain. And this is because the heart, the coronary program and the cervix program share the same brain relay, which I think is such a beautiful expression of what a lot of traditions have always known, like in Chinese medicine, right? There's this womb heart axis. And so I just love that the heart and the cervix also share the same brain relay. So we might experience some chest tightening or pain that's mild to moderate. We're going to experience those ruminating thoughts, but not a lot else in the active phase. Then when we resolve this conflict, meaning let's say we get over the big breakup, or we enter a new relationship, we're like, oh, this is my person. Or we resolve the conflict with our partner and we're like, actually, yeah, you are the person for me, right? Or we feel a sense of resolve and belonging in our intimate familial and relationship connections. Then we go into the repair phase. So of course, if there was cell loss in the active, there's going to be cell proliferation in the repair, because that extra space that was made around the opening of the cervix isn't needed anymore. So there's cell proliferation, and this is what shows up on, and again, quotes, abnormal PAP. We're seeing the rate of cell replication. So I really want to slow this down and let this sink in, because if you've experienced an abnormal pap smear, all that is telling you is that you are having cell replication on your cervix, which tells us that you at some point have hit a resolve of a sexual conflict. And I love to say this to women who I work with who are coming to me with this conflict. I'm like, let's go back and rewrite the story. Let's go back in time to that moment that your doctor sent you the test result or called you or were like, oh yeah, this is what it is. And just imagine how different it would feel in your body if a practitioner said, oh, it looks like you have a healing adaptation on your cervix. That means that your body is doing something vital to respond to a past conflict that you had around sex and intimacy. Tell me what's been going on in your intimacy, in your love life, in your relationship, right? Like, how much more spaciousness would we have around this scary thing that we're taught to fear? So that is what happens in the repair phase. There's cell proliferation. Other things we might feel are bleeding from the cervix, pain, cervical pain, or like kind of often I hear it described as like a sharp or crampy sort of stinging pain, different than uterine cramps, really specifically at the cervix. And then sometimes heavier bleeding as well. If there is bacteria that's helping do that replenishment process, which we know microbes come in during the repair phase, right? Then there might also be sometimes yellowy discharge as well. There's more to say there, but that's generally what it looks like. And those are the sort of baseline symptoms.
Yeah, I know that people, when they ask, well, why would the bacteria assist with, some people that have this adaptation and not others? And the really simple answer to that is it depends on the amount of cell ulceration that has occurred, because when the cell ulceration goes deep enough, that's when the bacteria would then jump in and assist. And, it just depends on how deep the ulceration has gone. So yeah. And also, if you want to speak a little bit on why hookup culture is perhaps playing a role in the prevalence of cervical cancer, HPV, if you want to unpack that a little.
Absolutely. Yeah, this is, and I want to preface this with saying what we were talking about before we started recording, which is that it can be easy to get hooked into this, oh, I need to live biologically, and it's right to live biologically, and how can we get back to living biologically, right? But this is not a judgment on morality, or even saying that one is necessarily better than the other, but it is to say that how we are living right now is vastly different than we have lived for 99.9% of human history. And so our bodies are going to respond differently. When it comes to how, until very recently, like within the past 100 years, how we have lived in family and tribe and community is women always knew who they belonged to. We belong to our family unit. We belong to our father figure, right? Our fathers are protectors of the female child until it was time for us to be passed off to a man. And then we would belong to that family. And so, and if, a man died or a husband died or we didn't have a husband, there was still family. It was like, okay, where are we going to put this woman? Right? The vast majority of time, she's going to be kind of assigned to a family. Obviously, are there pros and cons of that? For sure. We don't need to debate that. But it just is to say that part of our brain knew, like, yeah, I know where I belong. Now, that is very rarely the case, right? We leave home, right? We're away from our family. We are maybe in many relationships or none. When we are engaging, even if our conscious brain, this is such an important part of GNM, even if our conscious mind is like, oh yeah, like I can hook up with this guy, it's no problem. Like I feel good about it. Like I'm not stressed about it. If there is something that has caught us off guard, our subconscious brain can still be running, wait, is this my person? Who do I belong to, right? There's a biology to it, even if our quote unquote modern evolved consciousness doesn't have that same understanding. That's different than what the body is oriented to, which is safety. And particularly in the female body, there is an aspect of safety that is particular to relationship with men. And I want to put an asterisk there because you can actually also run this program with women as well, and in same-sex relationships too, which is interesting and maybe a whole other sidebar, but with the masculine and with like protection too in relationships. So hookup culture, we don't have that security in a lot of ways, and so we're far more likely to be stepping into this conflict and then stepping out of it, and stepping into it and stepping out of it.
Mhm.
Yeah.
Yeah, definitely. And I'm looking at my notepad. I'm like scribbling down all these notes and things that I wanted to bring up as you were talking.
Yeah.
It just brought up so many good points. So first of all, a quote from Dr. Sasha, one of our mentors. He said the worst thing a man can do to a woman is to
Yes.
waste her time. And I thought that was
Oof.
really funny, but so true. When you think about again, without morality being in the equation here, or even this isn't about right and wrong or bad or good or anything, but whether a woman wants to reproduce or not is not really the point, but ultimately her biology, her animal body, the whole point is reproduction. And
Yeah.
so I think that when we can view things through the lens of it's not good or bad or right or wrong, it just is. It's just biology. It takes away so much of the judgment from this. And we can, I think, view ourselves with more compassion and grace, understanding our conflicts through this very kind of, this straightforward lens of just biology. But of course, there's still so much more that we can add to this conversation. But do you want to talk a little bit though about how might a little girl who, is not in any sexual relationships, of course, how might a little girl experience this conflict?
Yeah.
And talking about her relationship with the protector and provider of the home. How might she have had fractured relationships with the masculine? How perhaps increasing rates of divorce could, again, without any judgment in the picture, like how is this perpetuating a culture in which we do have a lot of cervical adaptations?
Yes, thank you. Yeah, this has really been a game changer for me in supporting women with these conflicts. And I always look at, I tend to work with the recall healing and the life timeline. So I'm always looking at particularly the early life. And I would say at least half the time in my experience, someone's initial sexual conflict is actually with the father. And that doesn't mean that there's anything overtly sexual about the conflict. Okay, so just put that aside. Yes, sometimes, sexual abuse or molestation as a child or a sexual shock can absolutely trigger this conflict in a young girl. But I would say most of the time, what I see is these much more subtle conflicts that have to do with feeling rejected or unprotected or unseen by the father. And again, thinking as a mammal, right? When we're a child, like the father is the protector of the female sex and sexuality. And so we belong to the father until, again, we're passed off to another family. And so I have seen this conflict get triggered in even memories like, oh, that one time that I like went to reach for my father and he rejected me. Or, my father was always there for me. And then, he, in more of a larger thing, he had an affair, or he left the family, or even he didn't show up to my volleyball game. Right. Again, this is not always the really big thing, but it's the way that our psyche perceives, oh, this person is here for me, protects me, and then all of a sudden doesn't, right? There's a shift, there's a change. And that can be really helpful in unwinding these conflicts because it sets us up to later experience similar patterns often in our relationships. And, if we've ever asked ourselves, like, why the heck do I keep getting myself in these relationship patterns? Like, I seem to keep choosing the same type of partner or having the same type of conflict where I feel uncertain or I feel unseen. Often, in my experience, it's because we've had an experience in the earlier life that has set us up um, to search for what I call a corrective experience. So we'll actually keep experiencing a thing until we can meet it all of the way. And so for that reason, even if, your abnormal PAP came, or maybe you've had, like when I work with someone who's maybe had chronic cervical dysplasia, right? Meaning they're stepping in and out of this conflict all the time. Maybe that started for you with your first, big relationship at 18. But if we can also look back and be like, ooh, how have we been carrying this? Will this man protect me? Will I be left? Who has me? Who do I belong to? When
Mm,
we can see how we've been carrying that maybe all the way earlier into our life, I find the easier it is to resolve as well.
yeah, yeah, that makes a lot of sense. And, I think for our listeners or anyone that's newer to German new medicine, um, this topic of, right, how can a small child have a sexual conflict, right? I think you did a great job describing that, because from that primal perspective, from our animal body, it is more about that protection and belonging than, especially before puberty, right? Um, when, a child is not necessarily having sex. So, in that vein, I would love to ask about the normal age of periods, and like what would cause a girl to either have an early period or a late period, and is it with this conflict? Um, and do you see that a lot with your clients as well?
Yeah. So, from Dr. Hammer's perspective, and in this paradigm, the normal, typical, optimal age to start your period for menarche is between 11 to 12. So, it's in that year. And if we have our period later or earlier, that can tell us that we've had one or actually multiple of these sexual conflicts. And the reason that that is useful is especially if I'm working with someone on hormone health, on cycle health. I want to know, when did you first get your period? And then if it wasn't in that range, that can help us figure out, okay, what happened before that? What happened
Mm,
right before you got your period? What were those conflicts? Because this is a little bit of a rabbit hole because it has to do with hormones again. And I think probably the easiest way to say it is, again, the left temporal lobe controls estrogen primarily, the right temporal lobe controls testosterone. So, for example, if you are a right-handed girl and you experience a sexual conflict that hits the left temporal lobe, that's going to actually decrease your estrogen
mm,
temporarily and increase your testosterone such that you would not get your period at that 11 to 12 age. So, for example, this happened to me. So, I didn't get my period till I was 14. And I can track back now what some of those conflicts were. Again, they were not, in my case, directly related to sex, but they were related to belonging and protection. And so I did
mm,
not get my period at 11. And then I had to think, okay, what happened right before I got my period? Because what that would mean is we'd have a conflict that hits the other side, the other hemisphere of the brain. So if the left hemisphere is dealing with sexual conflicts, the right is the more male side of the brain and has to do more so with territory. Now, this is where it gets a little bit complex because for a female body, our sex and our body is our territory, right? It's our inner boundaries, our um, our body, our sexuality. And from the more testosterone or male perspective, our territory might be our space, our school, our workplace, our career, our home. And we can lose our territory. We can be afraid that something will happen in our territory.
Mm.
We can be angry about our territory. And so if I experience this sexual conflict from a young age, I'm now perceiving the world more from this testosterone point of view. So I'm going to be more oriented to territory. And if I have another conflict that has to do with sex and territory, if it's significant enough, it will flip me back into the estrogen side of the brain, and that will start the first period. So
Yeah.
it takes a little bit of detective work to figure it out, but that's generally what's happening. And it does vary with left-handed and right-handed. So sometimes, for example, like if a left-handed girl has a significant conflict, that might actually cause her to get her period earlier than 11. So there are multiple ways it can look, but in general, we know that if you didn't get your period between 11 and 12, there is something going on with your body and territory. And then we can help we can look at some of those conflicts to figure out what's going on hormonally.
Yeah. Yeah. Such a great description. Thanks for breaking that down, because
Yeah,
it's so complicated.
It is. This is where it gets complicated. So everyone
Um,
listening, just take a breath.
yeah. This kind of leads me into the next question, about hormonal birth control.
Okay.
And so I know for me, I did start mine at 11. My things started later, later in life.
Uh-huh.
But I was actually put on birth control for skin issues. I had really bad acne, but I know that it also helped with period symptoms as well.
Mhm.
So I would love for you to just talk a bit more about how birth control affects the hormones, and then how we can perceive conflicts differently if we're on birth control versus not being on birth control, and just like how that can alter things. Because in Western medicine, doctors are not necessarily, they don't know this stuff, and they're not bringing all of this into consideration when they put a young girl on birth control for multitude of reasons. And yeah.
Mhm. Yeah, thank you for this question. This is another really big topic. So I'm gonna do it as simply as I can, which is to say it's interesting now that there is more, even in the Western medical model, uh, studies and stories and evidence coming out to say, oh, wow, the female brain is really different on hormonal birth control. How interesting, right? There's studies about women um, choose partners that they normally would not choose when they're on hormonal birth control. And often when they get off hormonal birth control, they don't like their partner anymore, or something. They're like, oh, snap, wait, is this the right person for me? Or there's studies about how when we're on hormonal contraceptives, we have often more mental health issues. We have more anxiety often. There's a lot of impact in our overall behavior and mental health. So from this perspective, why would that be? Well, if you are a menstruating woman and you go on hormonal birth control, you are essentially putting yourself into the right side temporal lobe perspective of the brain. You are, instead of orienting from the estrogenic side of your brain, which would be typical for a right-handed woman, you are biochemically altering that hormone production. So it's
Mm.
like turning off that side of your brain, and you're now perceiving and experiencing the world more from the testosterone side of the temporal lobe. And so what that means is, yes, you likely will experience some symptom relief from particular conflicts, especially that are relevant to the estrogenic side of the brain, right? To the, perhaps the menstrual pieces, the sexual conflicts, the uterine conflicts, right? It's like turning that part off by instead of a conflict, it's almost like the hormonal birth control in itself is a conflict by flipping us into the testosterone side of the brain, which has us experience the world differently, which is why so many women do get into relationships. And then later when you get off of birth control, then often women will have either an experience of being like, whoa, I feel really different, or I don't see my partner the same way. Or, ooh, actually, do I like this person still? Especially if you got into the relationship while you were on hormonal contraceptives. I hear stories about this all the time. And it's because you're now, so if we had that right-sided testosterone brain, that's how we're perceiving the world. We take away the contraceptives. Now we're back into our normal biological production of estrogen and progesterone in their normal state. So it's going to flip us back into experiencing the world in this other more biological way, which then changes how we perceive and experience just about everything.
Yeah.
One way I kind of like to describe it too is it's almost a simulation of resolving the left side conflicts and then becoming now eligible for the right temporal lobe, conflicts, and the more, what we would say, the more masculine way of perceiving the world. So yeah, I think sometimes viewing it as like a simulation when you are making those biochemical changes. And I think people don't really realize the full impact of that and how big of a deal this really is. Of course, not to, put any fear out there. We wouldn't want that. But could you also touch on, while we're on this topic of birth control, how in the holistic paradigm, there's a lot of, let's just say, fear mongering about hormonal contraceptives, from the perspective of like, oh, they're so toxic, right? And how from the GNM paradigm, we understand them very differently.
Yeah. Yeah, just like most things, when we say, oh, something is toxic, it makes it seem that it is the product or the thing itself that is like causing harm in the body. And when we think about hormonal contraceptives, the primary action that then has a cascade of other actions is because of its hormonal action. So in some ways, I think this is different than like when we talk about gluten or blue light, right? Where it's like, oh, the toxin, where it's like, no, it has to do with how you are experiencing it. I would say hormonal contraceptives are a little bit in a different category because you are biochemically altering your hormones. And so that is going to have a cascade of effects. But rather than seeing it as like, oh, this thing is toxic, which can create more fear, more stress, more anxiety, we can kind of, again, take the judgment out of it and be like, okay, this thing is altering how I experience the world. It's chemically altering how I experience conflicts, how I experience the world. And so that's going to have in this case, a hormonal effect. And I think it's really, I think, the languaging also of toxins that I've worked with so many women coming off of hormonal contraceptives who are like, oh, I'm not getting my period back because of the toxins. I'm not, ovulating because of the toxins. I mean, I was like this, like I was only on birth control for maybe 3 years and I got off and was not ovulating and for almost a year. And I'm like, it's because it was so toxic. And I was like, no, because many women come off of hormonal contraceptives and go right back to ovulating. So what was it in my experience that was causing that? And it was other concurrent conflicts, right, that were also impacted by seeing the world and experiencing the world differently.
Yeah. Yeah. So true. And yeah, like we've talked about in pretty much every previous episode, it's about your relationship to the thing than the thing itself, whether it's, food or something else. But I do think it is important with birth control to realize that it's not just a track, right? That it is actually changing the hormonal balance and how your psyche is interpreting things. And, that has an impact,
Yes.
regardless of how you're seeing the birth control itself as like a quote, good or bad thing, right?
Exactly.
That does matter, but also not as much as for other things that would be considered tracks.
Yes.
So leading into our next question about cycle length and how our hormones affect this. Can you describe to our listeners or just talk more about, okay, first, what is the normal cycle length? And then what does a shorter versus a longer cycle length mean? And is it just with this sexual conflict, or are there other conflicts that could also impact cycle length?
Mm-hmm. Yeah, so a typical cycle length is about 28, 29 days. And if we are, in my experience, a few days even on either side of that, and particularly if someone's having short cycles, 26 days or fewer, if someone's having longer cycles, 32, 33, 34 more days than that, the first question I'm asking and looking for is there a sexual conflict at play? This is not the only conflict and program that can impact cycle length, but I would say it is the primary one. And again, if we go back to that two sides of the brain, left and right temporal lobe, left being estrogenic, right being more governed by testosterone, we know that if we have a significant sexual conflict on the estrogenic side that hits the estrogenic side, it's going to put us more in that testosterone side of the brain. And because estrogen is decreasing, it will often shorten our cycle length. It will often shorten our follicular phase. And because everything is connected, if we have a shortened follicular phase, it is also possible for that to impact our egg quality, our ovulation strength, and our progesterone as well. And if someone had maybe multiple conflicts and their conflict load was greater in the territory side, the testosterone side, but also maybe of a sexual nature, if that conflict was greater, that means that their testosterone would be low and their estrogen would actually be increased. And in those cases, it might look more like a longer cycle. So a longer, often follicular phase. So we can see both shorter and longer cycles with this conflict, depending on the hormone status, the handedness, and which conflict had greater weight for an individual. So that's mostly what I typically see. Sometimes the ovarian conflict can also impact cycle length because it's also impacting estrogen. And especially now, this is where we get into the conversation of, hormones is sort of I think we're at the cutting edge of science here in a lot of ways because of the challenges of studying the hormones from this perspective. But we are working on it. We're all going to work on the research together. But from my experience and what I see happening is with the ovarian program, it can impact ovulation strength and impact progesterone as well. So that could be a really short luteal phase, for example, but maybe normal estrogen or slightly decreased estrogen.
Yeah, I think there's still, you kind of touched on this, but there's still a lot that we don't know in GNM, especially as it pertains to some of the reproductive related SBSs or programs. And, Dr. Hammer was just one guy and he could only get through doing a certain amount of research, right? I think he did over 40,000 case studies, which is incredible, but there were still questions that were unanswered for him. There were still things that he was working on researching and things that he kind of had a good guess for or, a theory about, but was really not able to get enough data to make a definitive or to have a definitive conclusion. So, if you want to speak a little bit to that, just about
Yeah.
how there is so much more research still to do.
Yeah, it makes me really excited actually to know that. And I'm excited to be, colleagues with you all and others of our friends who are practitioners who are asking these questions because we we're learning how to take this paradigm and then ask more questions. And while there are so many things we do know, particularly most of the practitioners who study directly with Dr. Hammer and in that lineage are also men. And I have such love and respect and reverence for them. And there are certain questions that you might not ask if you're not in a female body. And we've experienced, and Abigail heard me, drilling one of our mentors, and I'm like, but what about this? And what about that? And he's like, oh, no one's ever asked me that before.
Yeah.
So yeah, there's so much to learn. And what I do, and I think this is helpful, I hope this is helpful for anyone listening. Yes, learning the details of this paradigm is amazing and will be so supportive for you. And you do not have to be a GNM expert in order to have successes in understanding yourself better, knowing your psyche better, and even resolving some of these conflicts. Sometimes it's really helpful to work with a practitioner. And there have been times where I'm like, look, I don't know what the conflict is. We're not really sure, but let's play around and see what works for you in having a shift. And
Yeah.
so I don't know, maybe it would be, I'm happy to do some stories as well. But I think when we get into these complex territories, it takes trial and error, and it's going to take some playing around with the practical changes, the perceptual changes to see, what happens in your body.
Yeah, we would love to hear some stories or case studies that you have to share about this because, you know, I think that's where, right, even even if we understand the specifics of each individual conflict, like we're never experiencing just one conflict at a time. Um,
Right.
that's theory, and that's how we can learn about it specifically. But obviously, we're all complicated humans, and we have a lot of different factors going into things and how we see the world. Our past programming, what's how we're viewing the world and how we see ourselves in that world. So yeah, do you have some specific case studies that you can share? Maybe more complicated ones that weren't as clear cut.
Mm. Mm-hmm. Yeah, well, I think I'll back up first and just give kind of a little bit of a list of many of the common triggers I do see for this conflict that are maybe a little bit lesser known. So we talked about, okay, so we're back in the who do I belong to sexual conflict and mating conflict. So we've talked a little bit about experiences with a father, so feeling rejected or unseen or unprotected by a father. uh, Unexpected porn exposure is a really big one that I
Mm,
actually find quite common. That can activate again, that can land in the brain as, ooh, this is something that's distressing to my sense of sex and sexuality and myself. Um, Certainly, unexpected rupture in a relationship. So that could be a betrayal or an unexpected separation. And again, this is where it gets into how we perceive it, because 5 people could experience an unexpected breakup. And for one, they're running a cervical program. For one, they're running a loss. For one, they're running separation. So that's kind of dependent on how we experience it. Um, and then uncertainty about having children with someone. So, ooh, do I want to have children with you? Are you the mate that I'm going to build family with? Who's the person that is going to build family with me? Whether or not you explicitly are thinking about children, if that kind of feeling of who is the person I'm building family with is up, that can be another common trigger. In myself, I've experienced this adaptation twice. Once when I was 18 or 19, and then once again this year, and very different scenarios. The first one was quite straightforward, but I think it's still useful to name because it is what many women who've maybe had, a low grade abnormal pap once, and then it seemed to go away on its own, right? Because it's already in resolution. What they'll have experienced. So I had, had a first love in my late teens, and already was so oriented to family, and I was very connected to his family, and just like felt this deep sense of like, this is someone who I will build family with and who I love so
Mm.
deeply. And when that relationship ended, I was very devastated, and I was in college at the time. And, it was only after quite a few months where I started to feel that internal sense of resolve of like, okay, like there will be other people, like this is okay, like my life isn't completely destroyed, as we do with first loves. And I had come home for break after I had had that, like, okay, like yeah, I can, this is going to be okay, like I will love someone again. And I had come home, and I think it was my very first pap smear, and it came back abnormal. And so that was a really clear, obviously I didn't know GNM at the time. I was quite young, but looking back, it was a really clear timing of the shock. I was in active phase, right? And then I get that internal spaciousness of like moving on from this relationship, and then I go into a repair phase. And that one, went away on its own within a year or so. Now, fast forward, and I am now with a woman, and we're married, and we want children, and we're exploring all the ways that that is going to look, which is a whole thing I won't get into. But what I will say is that we had a relationship rupture this past year where, mm, the content is sort of irrelevant, but essentially I went into a shock of like, do will you protect my heart? Like, do you
Mm.
have me or not? Like, can I trust this? Are you going to be the person are you going to build family with me or not? And it was as simple as a text message. And this is like, right, the specificity of GNM. It's like, you're fine, you're fine, you're fine. And then I read this text message, and I immediately am conflict active. And this time it was a pretty significant shock, and I had pretty severe chest pain. And it felt
Mm.
like this tugging, pulling sensation in my heart. And I immediately was like, I'm running the cervix program. Here we go. Okay. And I ran that program for like 7 months. And anytime that I was on the trigger of like, is this going to work out? Will you protect me? What's happening? That feeling of loss of protection. Again, even though this is now with a woman, right? I would have the chest pain. Long story short, we repair, and within a few weeks, a couple, maybe 2 weeks, I was spotting. So this time I was bleeding, and it was not around the time of my period, and I was like, oh, okay, something's happening. And I didn't have much pain, but I did have, sometimes in the epi crisis of this program, we will have elevated heart rate. uh, and so I had like a short period of rapid heart rate, bleeding from the cervix. And, as a birth attendant and doing women's health, I just happened to have a lot of speculums lying around. And so I was curious. I was like, oh, I wonder. I don't go to the gynecologist anymore. So I was like, oh, I just am curious as a teaching tool to see for myself, like if I can actually see anything on my cervix. And often in mild dysplasia, we don't see it to the naked eye, but I'm like, I've been running this program for a while, and it's pretty intense. So I'm guessing I can see something. And I looked, and I was able to actually see the cell proliferation on my cervix. I was like, yes,
Wow.
we resolved it. Um,
So cool.
and I think that's Mm. One of the things that actually helped me resolve it, in addition to the practical piece of like working things out with my partner, was actually doing this look back into my earlier life. And this is where I think, um, yeah, it's complex, but also so elegant because I was like, oh, this sensation of being triggered, this is a helpful tool for those listening. If you can get into like, what's the sensation in my body when I get activated into a track? And like really feel it and then be like, where else in my life have I felt this sensation? Forget the conflict for a second. Where else have I felt this? And when I did that, y'all, it was so fascinating. I went back to when I was 5 and the sensation I felt was the exact same. And get this, it was not with my father, it was with my mother.
Mm.
And I actually think that in my case, my first sexual conflict was with my mother because my mother was the far more masculine parent, we could say, like stereotypically masculine parent. And I had this distinct memory of being like, the panic of feeling her withdraw and not like protect me and feeling this intense state of like, wait, how do I, what's going to happen? And when I saw that and was like, oh my gosh, that is the same as what's happening right now, that shifted something for me in such a profound way that I think it really made the healing possible. And now, in that cool way, like, even though we still have stuff coming up in the same context of our relationship, I can't actually access that like 5-year-old sensation of in my body, which is pretty cool.
Mm.
Wow. Would you say that it was through awareness of that that's what kind of dissolved that for you?
Yeah, I would say awareness and being willing to play it full out. So this is where like part of how I operate is, again, I'm looking at like what is the body looking for in a corrective experience? What was I not able to do when I was 5? And what I was not able to do was actually show how panicked, right? This is the emotional isolation piece of a conflict. I was not able to communicate and show how terrified I actually was.
Mm.
And in my relationship now, I was also trying to be mature and calm and be like, this is fine. And this is serving a higher purpose, which was all true, but it was not giving the corrective experience to the 5-year-old who was like, will I be protected? Who do I belong
Mm.
to? And so the big medicine, I think, came for me in being willing to play that terror actually all the way and have my partner witness it. That really shifted something in me that felt like it moved the charge in a way that I think it wouldn't have if I had just, okay, yeah, I can like see it. I can see the connection, but the charge is still running. So that is a little bit more of a modality, we can say, or something, one of the many things that I work with, but I do think that that's an important piece, especially in sexual conflicts.
Yeah.
You weren't resisting it.
Yeah.
Uh-huh. Yeah. Because as the cliche goes, what you resist persists.
Yes.
Not a
Even if that
cliche
thing
for
you're
no
resisting
reason.
is like, which I think is really actually an important point, particularly in the holistic health and like mindfulness world. And also in our modern world and relationships, like we're all like, oh, we're like modern women and we're independent, or, we think positive thoughts and we do conflict in a mature way. And that's all lovely and great. But if we're putting that on top of an unmet biological need, we can't get ourselves out of it. We have to actually be able to turn towards it in order for it to move through. So,
Yeah. Very
yeah,
important point.
yeah. One other really quick story that I'll tell is, and I've actually seen this uh, maybe half a dozen times, that regarding the porn exposure,
Hmm.
that going back into the awareness of a memory of being exposed to porn for the first time also created an almost immediate shift in someone's sexual conflict, which is really interesting. And sometimes it has the flavor of, oh, this thing was really distressing to my sexuality. And a couple of times I've seen it in women where it had to do with their father and actually either being discovered by their father or experiencing their father consuming porn, and that creating a really big conflict of like, oh, now I like my father is not who I thought he was. And then later
Mm.
on in their relationships, anything sort of that flavor of like, oh, he's not who I thought he was. Sometimes it's specifically around porn, sometimes it's not, is activating that protection belonging conflict.
So maybe if you have other examples that could perhaps illustrate this, if
Yeah.
we could look at what a very light conflict load of this program looks like versus a larger conflict load where more tissue adaptation has taken place. Yeah, just to kind of show people the difference in symptoms and severity and what the range of this adaptation can look like.
Mm-hmm. Yeah, so the mild, and if you've had an abnormal pap, you might see it on a test result as SIN 1 or SIN 2, so a low grade dysplasia, which just means a more mild rate of cell proliferation. In these cases, which are super common, especially when we're young, especially when we're in our late teens and our 20s, and we might be engaging in those like, oh, partnership, oh, okay, maybe not. Oh, this breakup, okay, now I'm have another person, right? Whatever it is. In those situations, the symptoms are usually quite mild. For example, with myself, I didn't have any symptoms when I was 18, 19. I didn't notice any chest pain. I didn't have any in the healing. I didn't have any bleeding. I did not have any bacterial discharge. It was nothing. All other than the test result, that was the only thing. So we can have as mild as no symptoms,
Mm.
all the way ranging to, I would say a more moderate, which is like the angina, the pulling or tightening sensation, which sometimes we don't even think twice about. We're like, oh, that's just a random pulling sensation in my chest, body doing a little random thing.
It's never random.
It's never random. But like I think had I not known, I would have been like, that's weird, and then moved on, right?
Yeah, yeah.
And so, yeah, it can be chest pain, and then in the repair phase can be pain and bleeding. And I've seen it all the way up to like a far more severe, especially if someone is on and off a track, where they will have incredibly heavy bleeding that almost looks, akin to a hemorrhage when they hit a resolve or come off of a track with this program. And so in those cases, there can be like cervical cramping and pain and very heavy bleeding. In some of the cases where I've seen that, the conflict load again has to do with either the intensity or the duration. So, for example, I've seen this in women who perhaps for the last decade or 2 decades or more have been um, navigating this conflict of belonging and relationship and, who is my person. Or um, I had a woman who stayed in a very abusive marriage for a very long time, and then she was conflict active essentially that entire time. And then
Mm.
when she finally got out of that relationship, then she was diagnosed with cervical cancer. Right. So this is, the very high grade rate of cell replication, of replenishment, and certainly had a lot of heavy bleeding and pretty acute symptoms there. So bleeding, more pain, typically are what the heavier resolve symptoms look like. And then in a more serious case, usually the chest pain will be more severe during the active phase.
So just
So
to clarify for our listeners real quick. So you mentioned with the abnormal pap smear that is this conflict in the resolution phase. Again, just for anyone listening, So if someone is diagnosed with cervical cancer, is that the same thing? And that means that they've been in resolution for like longer, or the conflict was more intense, or yeah, what's going on with that?
Yeah, it doesn't necessarily mean that they've been in resolution for longer, but the resolution was likely more intense because of the conflict load. So that can mean either that when they were in conflict active, it was an incredibly intense conflict, or it can mean that that they were in conflict for a really long time.
Okay. Yeah. Makes
So
sense.
on this topic of cervical cancer, they are these big, scary labels that have been talked about in the conventional and holistic realms, right? Cervical cancer or HPV, these big scary things that cause people to seek um, reassurance, I guess, from the conventional realm through, going through the standard gynecological system and getting things checked out, just making sure everything's okay. Or if something's like not okay, then we have to do an intervention. So, what is your take? Because I know you support a lot of women in this. Um, what's your take on just opting out of the gynecological system? And I know we're, moving towards wrapping up here, but yeah, if you want to share your take on that.
Yeah, this is a really big question that I get asked all the time. And I always say, like, I will never tell someone whether they should or should not be engaging with the medical model. And so much of my work in particular is really about dissolving dogma in all directions. And
Mm,
especially because the whole point, right, is to be able to access more spaciousness internally so that we can actually make a true choice and access our free will. And so if we are firmly, "Oh, my only option is to go to the gynecologist," right? We feel in some ways stuck, like we don't have choice. But I also see women coming to me from the other perspective of like, well, I am not a sovereign woman if I get medical care and I have to deal with
mm,
this completely alone. Otherwise, I am not a biological woman. And then we create the same sense of internal distress and stuckness that's not actually in service. So when I think about interacting with the medical model, particularly in the gynecological model, I do think that learning the foundations of this paradigm is a really beautiful place to start, because if it resonates with you and it feels true in your body, then you can start to ask yourself, okay, what information do I actually want from the medical model? And am I interested in what they will provide me? Right. So for myself, am I interested in am I interested, one, in the information they'll provide from a pap smear? I personally, I'm not that interested, right? Mostly because I already have a really good sense of being able to tell when I'm running this program. So I can do my own inquiry and get my own data about this program. I personally don't need someone to give that information to me. That doesn't necessarily mean it's bad, but I will say we have to be honest with ourselves about the level of conflict shock that can come from simply engaging in this model. And I've had women had run sexual conflicts from a distressing gynecological exam,
yeah.
right? Let alone the diagnosis conflicts of like, whoa, what does it mean? And if I have this, will I be able to have children or be able to have a family or whatever it is? Um, I'll also say, in addition to, as we start to learn this paradigm, so I'll ask myself, okay, am I interested in what they have to offer? And then what will I do with the information?
Right.
So, right, if I'm considering, okay, someone's considering, do I get a pap smear or not? Well, what will you do if they tell you, yeah, you have SIN3 and we recommend a LEAP procedure? Are you interested in their tools for next steps? And if you're like, actually, yeah, I'm in a place in my life where like that feels like the right next step for me, then great, you might decide that that is a choice for you. But if you're like, no, I have no interest in that, then you might as well not go in, right? Like you might as well not engage if you already know you're not interested in what they have to offer. So I think it's really a process of self-inquiry and getting curious about what are we desiring? And I really want to emphasize too it is normal and healthy and innate for us, particularly as women, to want to have other women support us in our health. We were not designed to go through our reproductive years alone. Health care, health tending was designed to be in community. And because we don't have that, for most women, the closest thing they have is their gynecologist. And I just like to say that because I hear this from women all the time of like, oh, but like, I like my gynecologist, or like, I like feeling like someone is like looking out for me, right? Or I just want to have some type of reassurance. And we're so quick to be like, be independent and be sovereign and you don't need anyone, but we do need each other. It just sucks that the model that we've been given, often as our only obvious choice, is this model that comes with a lot of consequence and things that might not align with all of our values or how we want to be treated. And so I say that first to just have compassion for that desire, and to say that there are other options. If you're like, I want to receive care but not quite in this way, it's not that or nothing. You don't have to walk it alone. And perhaps that is actually the most biological thing, right? Is to be in our the navigating of our female biology alongside other women.
Yeah, so beautiful and so true. I was going to make a joke about why you don't need a gynecologist because you have your own speculum.
I mean, I used to teach that. I haven't done it in a long time, but I used to teach that, where we'd all be on Zoom together and like, this is how you, this is how you can look at your cervix yourself if you really want to.
Yeah. No, I think that would be really a powerful thing for women to know and understand, because you're in control, right? Unlike when you go to the doctor and maybe don't know exactly what's happening, or someone else is doing it, not yourself. I just think that's such a unique thing that I haven't heard anyone else talk about. So yeah. And before we wrap up, I wanted to mention for our listeners that if you have more questions about the uterine or the ovarian programs, or just want some more content to chew on with the reproductive conflicts, if you go back and listen to episode 15, it's more about the female related conflicts and symptoms. And that's another good resource for just learning more and educating yourself on, the different female related conflicts. So.
Well, this was such a beautiful conversation. Thank you so much for joining us today, Qiddist. I think our listeners will really hopefully get a lot out of this and just be inspired to really gain more insight and awareness around what's going on in their bodies and taking back control over their own reproductive health. So thank you so much.
Thank you both so much for having me. I look forward to all the research that we're going to continue to do, all the case studies.
Yes. Thank you so
Indeed.
much for listening, and we'll see you next time.
We hope you enjoyed today's conversation. We appreciate you being here.
If you would like some additional support in navigating your health symptoms, we both provide coaching services from a German New Medicine perspective.
Our Instagram handles and personal websites are linked in the podcast description.